Good afternoon, everyone. I'm Emily Brace, one of the consultant midwives.
And I'm Nikki Wango. I'm one of the midwives at the JR and the clinical champion for physical activity.
So this afternoon session, we're going to concentrate on looking at how we can keep you safe and keep you well, and look around physical activity and healthy eating. So I'm going to hand over to Nikki, who's going to kind of give you some tips and things around physical activity and healthy eating, and then please do feel free to send in some questions, and so that we can make this as active as possible.
Hi. So I just wanted to talk to you briefly about really how to maintaining a healthy pregnancy through use of diet and being physically active. And I think the two kind of go hand in hand. I'm hoping Emily will jump in from time to time.
Absolutely. I will.
So diet is more to do with kind of eating a healthy, balanced diet, which coming out of the Easter weekend, I'm hoping some of you are motivated to do after eating all the chocolate and the eggs. And it will both, being active and a healthy diet will help kind of with your body, but also help with your mind as well. So it's looking at each of the food groups and choosing healthy options. So starchy foods, looking at where you can use whole grain and like whole grain rice and whole grain bread, because in terms of energy levels, they are more sustained across the course of the day, but also are healthier for you.
So yeah, no, I'm just having a look at questions as we're going on, but Nikki, you carry on and I'll look at the questions.
Foods rich in fibre, again looking at the healthy options of those, so beans, lentils, grains, green leafy vegetables and that sort of thing. Making sure you get your 5 portions of fruit and veg a day, and being creative with those so it doesn't get boring, so choosing different options, but also looking at those as for healthy snacks, rather than reaching for those Easter eggs that are left. And buying things like rice cakes instead of chocolate biscuits, and that sort of thing. It will help with your digestion and ultimately be more beneficial for your baby. Looking at low fat options, which is, I think, common sense really. Avoiding fried foods, foods that are high in fat, high sugary foods. So and drinking lots of water. So if you think you're hungry, maybe go and have a drink of water instead. I don't think you can get enough water throughout the day. No, and also absolutely. With the weather being so lovely, it's really important to stay hydrated. And looking at portion sizes, because you're not eating for 2. So keeping your portion sizes. So I think that the saying eating little and often can sometimes work better, particularly as your body's growing and your baby's growing, and you can't necessarily eat as much in one go. So breaking down those portions into smaller portions throughout the day. I don't know if you've got anything to add to that.
No, I think you've covered quite a lot there, Nikki. Should we just talk about physical activity as well as and how that can really benefit you during the pregnancy, but also then feed into kind of labour care, and also a real opportunity for us to kind of get the family involved and look at that it's not just a component in pregnancy, that we want to try and look at this as a decrease in generational sedative lives, not being active, and how that can really improve your psychological well-being as well. So Nikki, do you want, I know you've covered quite a bit around kind of the chief medical officer's guidance around physical activity, and that it is safe to exercise in pregnancy.
I mean, I think it's really important to emphasize to women, especially in the times we're in at the moment, that it's okay for you to go outside for a walk. I don't want you to feel like you have to stay cooped up in your house. It's safe to go out and walk, provided you are walking in an open area where there aren't lots of people about, and not touching lots of things. It's, as Emily said, it's really, really important for your mental well-being to get out of the house once a day, to do a bit of walking if that's what you enjoy.
And also fresh air, and actually, you know, bringing your heart rate up, bringing your respiratory rate up. Actually, all of that will help release your endorphins to make you feel good. So actually, just being out in the fresh air, especially with the weather now turning a lot nicer. And I know it's difficult with the government guidance around ensuring, you know, social distancing is kept to a minimum. But if you are exercising and you are going outside, you know that it is safe for you to leave the house for your hours exercise, mobilize, you know, with people who live in your home. Again, is fine, but again, not having that exposure to other people.
It's also really beneficial in other areas. So that all that fresh air you're getting across that hour, going out for your brisk walk or whatever it is you enjoy doing in that hour, it's going to help improve your sleep as well, which can be problematic in pregnancy, particularly as your bump grows. It can also help with blood pressure problems. So some women find across pregnancy their blood pressure creeps up, so it can help control that. It's a really, really good way to help reduce the risk of gestational diabetes.
Absolutely,
and type 2 diabetes in later life. But if you find yourself with gestational diabetes or type 2 diabetes already, it can actually be a really, really good management for your blood sugars. To get out and do a bit of activity after your evening meal, for example, go and do a nice brisk walk. You can find that really, really helps with your blood sugar control.
And also, if you don't feel that you're able to leave the house, or you want to, it's thinking creatively, you know, get outside in the garden, you know, whether you're doing online videos or, you know, doing some yoga. Again, it's very beneficial to do that within the home environment as well. So it doesn't have to always be outside.
And actually, the guidelines in pregnancy do recommend at least twice a week doing some conditioning exercises. So things like yoga and Pilates, doing those online, because I know there are lots of free online sessions going on at the moment. But just bear in mind to modify some of these online classes have modifications for pregnancy. So just making sure you're not lying flat on your back and things like that, because it's not so good in pregnancy to do that. Lying on your side or popping a pillow underneath one of your hips or something just to prop you over. It's also good for your weight management throughout pregnancy, so you're not getting large weight gains, which can then be problematic after pregnancy to get back to your pre-pregnancy weight. So just kind of doing that hour's exercise, an hour's walk a day, or the guidelines actually say 30 minutes, and doing it briskly, so not a slow stroll. You're doing it at a moderate intensity, so getting you a bit out of breath, a bit hot and sweaty. You might feel your heart rate going up a little bit, and that's exactly what we want you to do. It's perfectly safe to do in pregnancy. I mean, as with most things, there are some contraindications to doing it. So if you do have any medical conditions or anything in your pregnancy that you might be seeing a consultant for, just be sure to check with your consultant before you embark on anything new. And if you are new to activity, that's great. It's great that you're motivated to want to do something, but just remember to start gradually. The guidelines say 30 minutes a day of moderate intensity. So it's start gradually doing maybe 15 minutes a day, 3 times a week, and slowly build it up.
And just listen to your body as well, because your body will tell you if you're pushing it too much, or if you're feeling any strains or niggles, then obviously you need to pull back then from those particular exercises. Again, just take advice from your midwife or doctor that's looking after you.
Yeah, definitely. And it's really, really good for your heart and lungs just to get out and be more active, and brings the family together. It's something you can do, and it encourages them, then children, when they see you being active, it will kind of carry it on in future generations, so it becomes part of your life.
Absolutely. Yeah.
And I think that's important, doing it as part of your life, your everyday life, as opposed to thinking, oh gosh, I've got to go and do something now. So just making it part of your day. Walking, when the children go back to school, walking them to school instead of jumping in the car, is an easy way of doing things, using the stairs instead of the lift. Yeah. So people that live in flats, perhaps if you haven't got access to outside space, you can still do your activity by using the stairs.
Cleaning, you'd be surprised at how much you burn off, or gardening or anything like that you can burn off calories and get your heart rates and a little bit out of breath when you're actually starting to do those activities.
And some women find it easier to do it in 10-minute bursts. 30 minutes might be a bit too much. So do it in 10-minute bursts, and anything that gets your heart rate up or you're a bit out of breath counts. Anything for more than 10 minutes counts towards your 30 minutes a day. And be creative in what you're doing, so it doesn't get boring and mundane. And I think everyone needs to get out at the moment, like you said. It's important for your mental health. And also, when you do exercise, it really does help refocus the mind as well. So if you're feeling anxious about anything particular, exercise in itself can be hugely beneficial in refocusing the mind. I'm actually just reading one of the questions.
Do you want to read it out, Nikki?
So Elizabeth is 21 weeks pregnant, and all she wants is ham sandwiches, strawberries and chocolate. Well, the strawberries are definitely brilliant, so keep going with those. That's fantastic.
And again, everything in moderation. So again, if you're having the strawberries and you're feeling like you're really missing out on chocolate, is thinking creatively and maybe doing a few strawberries that are dipped in some chocolate, but then being trying to put the chocolate aside then until the next day.
We're using some brown bread instead of white bread. Is great. It's great that you're drinking lots. If it's something you're concerned about, staying hydrated, or you feel that you're drinking lots and lots of water but it's not seems to be quenching your thirst, speak to your midwife about it.
Or sugar-free squashes or anything like that. Again, just trying to avoid your sugary drinks. So things like Coke and fizzy pops and that are full of sugar. So try and look for alternatives with that. So whether it is a diet drink or ideally a sugar-free squash. If you are looking and drinking a lot of orange juice, think, again, that can be quite high in sugar and will release the natural sugars within the fruits. So again, you wouldn't want to just turn solely towards orange juice and all of the kind of smoothies and things like that, because although it's kind of seen as part of your, 5 fruit and veg, but again, it can carry a lot of hidden sugars within those drinks. So wherever possible, just try and look for alternatives and have that balance. But if your body's telling you feel that you're quite dehydrated, then again, listen to what your body's saying and do increase those fluid levels. So that was from Elizabeth, just looking to see what alternatives there could be around chocolate, strawberries, and again, keeping yourself hydrated. So there's another question there from Sophie Martin. Says, I'm 33 weeks and have nearly run out of pregnancy tablets. Should I buy some more, or is it okay to stop taking them? I'm assuming you're talking about like a multivitamin, a pregnancy vitamin. So if you've started them, I mean, again, the advice from the Royal College and again our national advice is if you have a good balanced diet, there's not necessarily the need for you to take those vitamins, but again it depends what tablets you're talking about. So folic acid certainly within the first trimester, vitamin D as well. So again, if you can give us a little bit more clarity there, Sophie, then perhaps we can help you with that question. There might be one just up the top there. Hang on, sorry, we're just having a little look at another question. I don't think it's quite come through. I don't know why. Can you see what it says just under? Okay, I think it's about 25. I can't quite see the name, I'm sorry. It's faded within our comments box. It looks like Leela, 25 weeks, and is this appointment still going to happen? So there's lots of useful questions on our maternity webpage now, frequently asked questions, fact sheet that we would signpost you to look at. And that has quite a lot of questions and answers around revisions in care. So what changes have we made in relation to antenatal, postnatal care? And again, you know, when we would need to see you, your community midwife would need to see you. So 25 weeks, it depends on how many weeks, it depends on how many babies you've had before, if this is your first pregnancy.
I think the 25-week appointment is usually with the GP, isn't it? So
I know, but we've changed. Nikki was just saying the 25-week appointment is normally with the GP, but because of COVID-19, we've had to make revisions in antenatal and postnatal care plans. So I think the question was around whether this appointment would still happen. The face-to-face contacts are now at 28 weeks. So providing there's no other risk factor at 25